I want to talk about healthcare and frontline workers who are or are not being vaccinated. We've seen reports in Bloomberg has published reports that said that the federal government is suggesting pizza parties, raffle prizes, and even iPads to provide an incentive to medical staff to take the vaccine while it's being offered to them. Why do you think we're seeing the resistance? And do you think that spells trouble for the general population if they don't see those folks who are on the front lines actually jumping up and down, raising their hands to get this vaccine?
Yeah, so there are certainly aspects of healthcare workers that are vaccine resistant or vaccine shy, but it's not across the board. And it depends on the region of the country, and there are some cultural issues, particularly among minorities, that have a bad reputation with the medical system. I don't mean the people have a bad reputation, the medical system in terms of how it's treated them. So they're very shy about new medications, even if it's vaccine. And so there's a tremendous amount of distrust. We can't easily mandate giving everybody this vaccine the way you can with flu because it's under emergency use authorization. So that, given that, and it hasn't been tested in absolutely everybody, we can't outright force people to get vaccine. But you are seeing exactly what you're talking about. I mean, you've heard people being given bonuses of $500 for taking it. Some people have invoked kind of a punishment, meaning if you don't get the vaccine and you get sick, we're not going to cover you. So there are various ways that people are approaching to get the healthcare people vaccinated. It's very, very important, though, to have healthcare workers and those associated with the frontline healthcare workers vaccinated. The health system is absolutely bursting. There is no elasticity in it. And we have to maintain that workforce.
Dr. Kellen, if 2/3 of people in the U.S. will get vaccinated, that means 1/3 is showing some sort of hesitancy for it. That's not enough to reach herd immunity by inoculation alone. What does it mean for the end of the pandemic if we don't see the vast majority of Americans get inoculated?
Well, if 2/3 ultimately get the vaccine and 1/3 don't, then about half of that 1/3 is ultimately going to get sick. And my message to those people is, well, if you don't get the vaccine, what chance do you want to take? You want to take a chance that you're going to get sick, and depending on who you are, you have 1 in 1,000 to 4 or 5 per 100 likelihood of dying, and 10 times that of being permanently disabled. Or do you want to take the vaccine and maybe being that 1 in 1,000,000 of having some type of a reaction? It seems like a very, very easy decision when you put it in those terms. So get vaccinated or get infected and take your chances. But also remember, if you want to take your chances and you get infected, you yourself become a weapon. And you have the potential to spray little viral bullets all over the place and infect people who maybe even got the vaccine, but it didn't take, and you're going to kill people. So get vaccinated, please.
A weapon that can spread viral bullets and kill people. That seems to be effective messaging, at least for me. Emergency physician at Johns Hopkins University, Dr. Gabe Kellen, live from Baltimore. Thank you, Dr. Kellen, for your time. We should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, the founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.